Hi, this is Patrick Horn, president of GAP. Thank you to our sponsor, Ardelyx, for their support of this FAQ video module.
Hi, my name is Amy Ladewski. I'm a physician assistant at Northwestern Memorial Hospital in Chicago, Illinois. I focus on neurogastromotility disorders and disorders of gut-brain interaction. It's a pleasure today to answer some KOL questions. Today, we will be talking about how do you have a focused and meaningful conversation with your patients to understand the impact that their therapy is having on their lives. We'll be talking about specific questions that you can ask, as well as how you can assess their response to treatment. When having a focused and meaningful conversation with your patients, it's vital that you are establishing rapport and have a patient-centered approach. You have to let your patients know that they have the time to open up and that you sincerely are concerned about their symptoms. When I talk to a patient about their response to therapy, I always focus on quality of life. Quality of life is the reason that we're treating the patients, and we want to ensure that the therapies that they are on are improving their quality of life, their ability to go to work, go to school, interact with their children, leave their home, and not feel like they're a prisoner to their bathroom. When I talk with them about their treatment response and their response to therapy, I let them know, our goal for you is not only to have improvements in your bowel habits and to improve regularity, but also to improve those abdominal-related symptoms of abdominal pain, bloating, and distension. That these are symptoms that we have FDA-approved therapies to treat, and they do not have to accept that they have to live with their symptoms, thinking that there's no other alternative. Specific questions I like to ask my patient during our appointment is kind of an algorithm. I first start with asking about their bowel habits. How often are you having a bowel movement? I pull out that Bristol Stool Scale and assess their stool consistency. I ensure that they're completely evacuating. My goal is for them to have at least 3 complete bowel movements per day to 3 complete bowel movements per week. Then I transition into talking about their abdominal-related symptoms. So if they have those improvements in their bowel habits, it's also important, obviously, that what they think is perceived to be the most bothersome, their abdominal symptoms, are also being addressed. So I ask them, how bothersome is your pain, bloating, distension since starting your therapy? Have you noticed an improvement? Are these symptoms that are still bothering you? I also ask about their side effects to their therapy. Is it predictable? Is it something that they can take daily and not worry about having laxative-induced diarrhea? Is it strong enough? And these questions will help guide my decision on deciding to maintain on their therapy or adjusting to a new type of therapy that may improve their symptoms and predictability. In summary, I want to ensure that my patients have an improved quality of life as well as control over their constipation, as well as improvements in their abdominal-related symptoms. If they don't, it's time to have a discussion about a different type of therapy to target their IBS-C. Thank you for listening today. This concludes our KOL. Please visit the GAP website and app for additional information.